Welcome, John. Good morning, class.
Good morning, everybody. Good morning, my friend. Shago.
Good morning.
Good morning, everyone.
Morning, Doc.
Hello, good morning.
Morning, sir.
Good morning,
Good morning,
sir.
sir.
Good morning. Hope you are all doing well.
Yes, sir.
Yes, sir.
Yes, sir.
Good morning, sir.
Okay. Good morning. Sorry for challenges sharing my screen. My system was malfunctioning and I wanted to switch over to the phone. Let me start this lecture by going to take a review of the last exams we wrote. Are we all together? Are we all together?
Yes,
Okay.
Yes, sir.
together.
Yes, yes, sir.
Hello.
We're together.
Can you
A lot of us did well. Most of us did well. Some of us didn't perform very well. I really don't know why. but I want us to do a very brief evaluation of that exam and the last lecture to see if there are areas we really need to improve. Maybe it's the methodology that was adapted in for the class or for the purpose of the class, or maybe you never understood the questions, or maybe didn't deliver well, so that for the second semester we'll be able to do better. So can we have a very quick assessment why the performance was not very, very encouraging? Can someone give us or give me an insight? Hello.
Hi,
Hello.
so yeah.
Yes, I'm listening.
Good morning, sir.
Good morning.
Thank you, sir. In my own view, I will say that whether we like it or not, there is a difference between remote learning and on-site learning. So,
Yeah.
but then the exam questions, in my own evaluation, they were set like a class that was held on site instead of a remote learning. They didn't factor the fact that this lecture was taken online. And at some point, some students find it difficult to join due to network failures and all of that. So the exam questions actually didn't factor that fact that at some point, some people were just struggling to catch up with the lecture. Not as if they were not interested, but maybe due to network failure and some other factors. So for me, that's what I would say was part of the problem. Like I would say, not just in your course, but there was a particular course that up till today, I keep on reading the question paper to actually understand the questions that were set for us. That's my own review of it.
Hello.
Hello, sir.
Yes, I'm with you.
Okay. No, sir, I said the fact is that there is a clear cut between remote learning and on-site learning. And
yeah,
you will agree with me that on remote learning, it's difficult at some point for lectures to be delivered without hitches. Sometimes some students find it difficult to flow along, maybe due to network failure and some other issues that may come. So I think in setting the exam questions, you also factor those kind of situations that we're not very sure if we are all on the same page, because if it's on site, then we are sure that what was passed seamlessly. Everybody was on the same page. But in the situation of remote learning, it's not as if some students were not serious to be part of the lecture, but maybe, like I mentioned, network keep throwing them out, and some vital points we are missed out. In as much as we have the materials, the lecturer's explanation is always the ultimate. And if you miss the explanation, you may find it difficult. You may read a point, but give your different interpretation, different from what the professor is saying. So I think in certain exam questions that has to do with remote learning, that should be factored in. Like I gave an example, not just in your course, but then there was a particular course we took that up till today, I am trying so hard to understand the demands of that, the questions that were asked in that exam. Thank you, sir.
Thank you. Yes, any other person? Any other person? Any other person?
Good morning, sir.
Good morning.
My name
Good
is
morning, class.
my name is Chagu Ted.
Hi.
Hello, sir.
Yes, I'm with you.
I personally I feel that apart from that 1 week we went to class, which we had that face-to-face, the other ones, I think we just be struggling. Everything is just struggle. You just struggle. Apart from the materials, you just struggle. Some of those practical explanations that were given in that class were most of the things that we head on to. So for many people, even myself, sometimes I feel that the online stuff, the thing has its own challenges. Network is just one of it. Power shortage is one of it. Keeps throwing you out. Keep looking for where to charge your phone. Depends on your device and all of those things. And again, I don't know. Maybe the way they ask those questions were somehow difficult, very difficult. I don't know. But that's just my thing. Apart from those things, yeah, that's it.
In addition to previous speakers.
Hello, good morning, mate. I hope I'm not missing something.
Yes, I'm with you.
Before, please.
Yes,
your lecture was well delivered. I kept saying. But there's one thing. You taught alongside with your colleague. And there were the notes which you all gave were a bit bulky. And each note having numbers, and and everything appears to be an exam question. So it was not easy for us to assimilate all what you taught and read for exams. So that was why we were expecting that you would give us to lessen our work and to focus on something that we may likely come out as exam, or areas where we can read and focus. But you just say we should read all what you taught, and the other of your colleagues say we should read all what they taught. And reading and assimilating all what you taught, you and your colleague, it was not easy. Embracing other of your colleagues who lecture in other, it was not easy. I think our brains are not computer. I think that is the area. Because to be very frank, those that give us areas of concentration, I think were better off. And those that did not give us areas of concentration, it was very hard. Thank you, sir.
Okay, thank you. Yeah. Any other observation? Any other observation? Hello?
Hello, sir. We are with you.
Hello? Okay, is there any other observation? Hello?
So I hear you. Right, you, sir. Good morning, sir.
Is there any other observation?
I think that will be all for now, sir.
Okay, that's all for now.
Yes, sir.
Okay. How many of you present here were in one of face-to-face interface in that revision class?
So we didn't get you well.
How many of you were on this who are online presently were in that revision class?
I am one of them. Jigba,
I was one of them.
I was present.
I was present then.
I think we also discussed our revision was centered around some of the questions or the areas that questions were asked. If I have a flashback on our revision, back to the questions that were set. And if you will remember, even the question that we had discussed or that came up as a case was also discussed in the class, only that we changed the name that was on that case. Was that?
Yes, as it should be.
And I'm really finding it very difficult to connect.
Hello, I'm not hearing anything. No. I hope there's no problem.
Me too, I'm not hearing no.
Oh.
So we're not hearing you.
The lecturer just said he's finding it difficult before his phone went off. His mic went off, so it's actually maybe a network issue.
Okay. You're waiting.
I think network threw him out. Can you hear me?
Yes, we can hear you now.
Yes, sir. Yes, sir, we can hear you now.
All right.
We are hearing you, but it is echoing.
Pardon? Okay. For those of you who were in our previous, in the last on-site class, we had also discussed the questions as they were going to appear on the exam day in this guide. So I'm wondering whether it was exam anxiety or what else. Be that as it may, can you hear me?
Yes, sir.
Yes,
Yes, sir.
Okay, be that
Yes,
as
sir.
it
Yes,
may,
sir, we are hearing.
we'll continue engaging together as we continue with this class to see the best approach to exam questions that could meet the required standard, and also not put so much stress on the students, and that will not invalidate the learning efficacy. So for this semester, we are going to be looking at theory and practice of counseling and psychotherapy.
The network is not okay, sir.
Practice of counseling and psychotherapy.
Sir, we can't hear you well.
No.
Hello, sir.
Doctor, the network is not favorable at all.
Mputu, can you please mute? I'm getting confused with what I'm hearing.
Yeah.
That is like the network fluctuating and we're not getting clear the wordings from.
You're not even hearing anything from him.
Can you hear me now? Hello?
Yes, sir.
Yes.
Hello?
Yes,
Can you hear me?
Yeah, we can hear you now.
Okay. Now, one of the challenges of remote learning is also learners' attentiveness. Most often than not, the learners mute their mics and they are engrossed in other activities. Now, for remote learning, it is expected that the learner will pay very close attention to the lecture as it is being delivered. And I also observed that most often than not, several of the students were carried away with their other activities other than the lectures. Now that impedes significantly on your understanding of the lectures as it is being delivered. I hope we'll also take a look into that and also make some amendments for this semester. Master's programs are expected to be also independent studies. So lectures form a guide to areas where you can read and also research and also improve your own understanding. However, we'll make our slides as simple as possible and as also understandable as possible for this particular class. Are we together? Yes,
Yes,
sir.
sir.
Yes.
Yes, sir.
Okay.
Yes, we are.
Okay. So for the purpose of this class and for this semester, we are looking at the theory and practice of counseling and psychotherapy. Almost every one of us is a counselor because we must have heard ourselves saying, yes, he had a problem and I counseled him. So by way of definition, by way of the what
But your network is breaking.
Today's network is bad. Always. Don't even know. Can't hear anything.
I am on the opinion that this is a lecture that should not be with some fluctuation with network. So we should kindly look into it because we're not getting anything that is going on. And it's a lecture, theory and practice of counseling and psychotherapy. It is a very good lecture, but we're not getting anything coming from it.
Thomas,
Sir.
you should understand that it's network, and nobody can do nothing about network issue unless the network is frequent and accessible. So it's for you as a student to be patient and be here till whatever it is, we can follow up. Please.
Well, it is a very good thing that you have said it.
Mputo. Yeah.
And class, we should understand one thing about this program where it's an online program, and as far as it is, Nigerian network setup is not a stable, accessible. So anything that it is about network frustration, we should understand that we should just be mute and wait. Whatever it is, we can pull through. Please.
Okay, good morning, class.
Morning.
Good morning.
If I don't even know where today's memories are coming from. I don't know. But then these are things we shouldn't be discussing here. But then we don't have any option than to discuss it. I first thought it didn't fit that we should do this thing online. Like we discussed it the first time. Anybody who is not comfortable with it can simply pull out. But then in the middle of a semester, in the middle of a program, then you saying it should change because you feel it's not comfortable for you, I don't think it's right. We wrote our exams for 3 weeks. You all saw what was happening. So my own suggestion is, these people, they are lecturers. You know where to find them. If you feel so
Okay, let's
uncomfortable,
can talk about it. It's okay.
please
We have heard your
don't.
point, please. Let's talk later.
No.
Please.
No.
Drop it
We need
on
to
our
put
chat.
it
No,
here.
the
They said
specific
it, so
that
let me put it here.
You
Our
obey.
lecturer is
You obey.
If anybody,
it's
our
not
lecturer
good.
Obey.
It's not good. Leave it.
just leave
lecturer
it.
is not yet back. If anybody doesn't, you can trace where the lecturer is. Go to his office. When he's teaching us online, you can sit there and be hearing it. Okay, if that's comfortable for you. But then let's not move from what happened that you are here. The program said it's online. So you opted for an online class. Then all of a sudden you want it to revert back to what you want. Everything okay. What if you are coming to school and then you do an accident and die? Everything has its own disadvantages and then its own merits. I feel some of the complaints raised, they are not even supposed to have even popped up entirely. And then this issue of telling something should be done about network, nobody's responsible for network. Nobody works with NTN here. Nobody works with Glo or any of the network things. So expecting that there are network concerns, you chat me to tell me that network is not good, I should do something about it. I'm wondering, this thing is not about Zoom, it's about your own network. So if you feel your network is not good, leave the area that you are currently, go to another place or change to another line. We have Glo, we have NTN, we have all of them. You can change to all of them. It will work for you.
Fine, those on have it. Stop quarreling now.
The lecturer is back now. Can we please give him the time to continue? We are not here for all this discussion. We are here for lecture. So the man is back. Let's give him a listening ear now.
But you are the one that started murmuring.
Silence is the best answer to a fool. So what are you for call you down?
Sorry, I don't think the last speaker, what you said is right, please. Nobody's a fool here, so we shouldn't be saying that to ourselves.
Already on this platform, please, let's just stop and take it somewhere else. Ejo.
Or should I hear about was an yo? Was what that kind of introduction during practice of counseling and psychotherapy. Say
I don't know why you people are behaving like this today.
Course is psychotherapy. Now in our behavior or module, how more weight you looking at 1%?
Thomas,
Thomas, you just came to this class for this semester and then you are becoming too lousy.
What's the meaning of that? I will force you on your lecture. I will drop out. They will lament you to 200 you fool and embarrassing you. What's the meaning of that?
Thomas, you're becoming a menace in this place. Please.
I'm telling you, what is wrong?
Desmond, please talk with the so that the ICT so that you can.
Nothing.
Seriously, you guys are surprising me.
Class, obey. If the network from the lecturer is giving him headache,
that's not what I said. I said, but if you can talk with the ICT so that you can be a co-admin and mute these people making side comments, please. So that we don't keep embarrassing.
It doesn't show maturity again. The lecturer is online here trying how to see if he can connect himself back and give us something useful. And then what we are saying here is being on record. When we are busy saying all these things, exchanging and doing all this, it's not matured now. We are bigger than this.
Sir, this is network issue. We should not blame any of us. I beg.
Hello, can you hear me now?
Yes, sir. We can hear you.
Sir.
Yes, sir.
Okay. Okay, so I'm saying that can you hear me now?
Yes, sir.
Yes, sir.
Yes, sir.
We hear you.
It's all right. For the purpose of our class today, we are looking at theory and practice of counseling and psychotherapy. And before the network started giving us problems, I was saying that each and every one of us is a counselor. We have counseled people. People have problems and have come to us, and we have offered counseling in our own little way. And I want to ask, by way of understanding, what then do we understand counseling to be? What do we understand by counseling?
So let me try.
Yes.
Counseling, to my own understanding, is a way of trying to correct or educate someone or a group of people on a particular thing you feel is not done right.
Okay, a way of correction, a way of education, educating someone on things that are not right. Yes. Any other attempt?
Yes, sir. Let me also try.
Yes.
It's a professional way of offering or assisting a client to identify his or her problem in order to proffer solutions to them.
It's a professional way of identifying a
It's a
client.
professional way of, yes, client's needs and helping him or her overcome them.
Okay, it's all right. Any other?
Yeah, but let me try to.
Yes.
Hello.
Yes.
To my understanding, counseling is advisory, is a kind of a guidance given to someone, be it career or value based. Thank you.
Okay, it's a form of guidance. It can be career. It can be
Recording in progress.
That is value related.
Okay. It's all right. So for the purpose of this class, we are going to look at counseling in a more professional way, where we will have a better understanding of what counseling is. Are we together?
Yes, sir. Just the
Yes,
network
sir.
is seriously
Yes, sir.
disturbing from your end.
Yeah, the network is actually giving me a lot of headache. I've changed. This is the fourth location. Trying to see how we can have this lecture seamlessly. Let me see if I can change even this location. Let me see if I can change this location. Hello.
Hi.
Yes, sir.
Can you hear me now?
Yes, sir.
Yes, sir.
Yes, we hear you.
You, but we can't see your slide.
Yes, I just got this network. I want to share that slide again.
Okay, sir.
Can you see the slide now?
Yes, sir. It has come.
Okay, so all the attempts you have made to that definition are correct. But I also want you to begin to imagine and feel emotions. You have emotional issues. You're having difficulty with understanding your body system. You're having problems coping. You're having the different forms of challenges. Counseling. When we are talking about counseling, I want you to put yourself first in a position that you have problems and you need help and you are looking for someone to help you. So by way of introduction of this course, we want to say that being able to imagine and feel emotions with in-depth understanding is what makes human beings different from other creatures. Now, for every human being, he has a challenge. Every human being has a problem that he really needs help, isn't it? So when we have problems and we need help, we react according to the situations and the scenarios in different ways as they present themselves or as they impinge our sensory system. Are we together?
Yes, sir.
Yes, sir.
Yes, sir.
Now, it's sad how in the old days, psychological traumas were left, unattended to. Before now, people had problems, but they never had a shoulder to lean on. They never had someone to discuss their problems with. So their problems were unaddressed. But with the advent of technology, people are beginning to understand how they can start addressing their emotional issues. These emotional issues may be stemming from their schools. It could be from family relationship. It could be from marital relationship. It could be from workplace challenges or workers relationship, and amongst others. So counseling as a cause or as a tool that is used in addressing some of these emotional challenges have become handy. With the advent of technology, you can sit somewhere else and also receive counseling over your problems. Unlike in the olden days where you could have problems and because you could not have direct access or quick access to communicate with someone to help you, your challenges remain with you, and then they eventually reap life out of you and good health out of you. So while you were all trying to give a definition of counseling, one thing was common with that definition you all gave. It was pointing all of us towards the fact that there is a problem and there is a place solutions can be gotten. Are we together?
Yes, sir. We are
Yes,
with
sir.
you.
Good. addresses challenge.
Hope I'm not the only one that is not hearing anything again.
I was almost asking, so it's like it's you and your sister that is going through this.
It seems the doctor be thrown out by the network also.
He's a lecturer that is having issues with his network.
Yeah.
He's been thrown out.
Okay. Okay, thank you.
Okay, hello, are we back? Hello.
Yes. Yeah, hello, guys.
Yes. The
We
network
can hear
has
you now.
actually, the network is actually giving me kind of problems. Okay, so just like I was saying before the network went off, that in counseling, why people have a lot of challenges and they're looking for best way to solve them. Counseling is a process. Counseling now becomes a process where an individual, it could be a couple, it could be a family, it could be friends, it could be a group of people sharing the same problems. They meet with a trained professional counselor. They talk about issues and problems that they are facing in their lives. Is that okay? Hello?
Yes, sir. Hearing you, sir.
Are you hearing me?
Yes, sir.
Yes, sir. We are.
Okay.
Yes, sir.
So these people look for someone who can provide help to the problems that they are actually facing. Now, professional counseling, on the other way, it's a confidential and non-judgmental approach. And it can provide people with opportunity to share their views. It provides them with an opportunity to be heard and gain new perspective of their situation and experiences. Now, in counseling, there are four key things that I have mentioned as I'm trying to explain further this definition of counseling. That it is a process where an individual, it could be a couple, it could be a family, it could be people working together. They meet with a trained professional counselor to talk about issues and problems that they are facing in their lives. Now, in this professional engagement or in this engagement, there are basic principles that are outlined in this engagement. First is the principle of confidentiality. And that is why we are saying further that if counseling is confidential, it is non-judgmental because the person who has come to you is not judged based on his strength or based on his weaknesses. Now, the counselor provides them with an opportunity to air out their views, their grievance, to air out their concerns, to air out their challenges. And he listens to them. And as he listens to them and provides her, they gain new perspective into their own situation. Are we together?
Yeah.
Yes, sir. We're
Yes, sir.
together. Only that your slide is not on for us to be seen. Thank you.
Pardon?
We are with you. Only that your slide is not on for us to see.
Yes, I'm also trying to share it. The network is fluctuating and it's making it very difficult for me to share this slide. I'm still working on it. But we'll continue. And once it turns up, I'll share it with you. I'm still working on that.
Yes, that's a problem, sir.
No
Okay.
problem, sir. Thank you.
All right. So, the client, the person who comes to seek help is called the counselor, and the person providing help is called the counselor. Now, together, the client or the counselor with the counselor, people who seek help are able to identify and work towards achieving the desired outcome of the reason why they came to see the counselor. So everybody that has come to see a counselor, you know, he has a reason of coming to a counselor. He has a problem, he wants help, and he wants the counselor to provide that help. So, because he has come, he will work together with the counselor to ensure that his problems are being solved, his challenges are being attended to, and he has a better understanding of what his problems are, and a better understanding of how he can handle his problems, and a better way of improving his own well-being. Are we together?
Yes, sir.
Yes, sir. We are together.
Okay. So counseling is not just a meeting, but that meeting is therapeutic. It's therapeutic in the sense that at the end of that meeting, there is a healing that takes place. There is a healing that takes place. So the counselor the counselor provides an avenue for that healing to be received. The counseling opens up to the counselor in very sincere and genuine manner that he will receive help from the counselor. Now, counseling does not just happen. It is a process. Counseling is a process. It is a process that involves the counselor. It's a process that involves the counselee. Now, two people are involved, or two persons are involved in the counseling process. One comes to receive help, the other provides the therapeutic help that is needed by the other. Are we moving together?
Yes, sir.
Yes, sir.
Are we moving together? So when a person seeks counseling, he or she suffers from something serious. It can be a mental issue, it can be an emotional problem, it could be a family problem, it could be a work problem. Are we together? Now,
yes, sir.
Now all these problems are giving him discomfort, that he needs help from a professional so that he can come out of it. Now, counseling, for coming to counseling, there is a process. The counseling offer is a process that has a series of step-by-step procedure that the counselor must follow, and the counselee must also follow in order to have a desired outcome. Now, every client or everyone going to the counselor, he has a reason of going to the counselor. He has a problem that he wants the counselor to help him out of, so that he can be able to overcome it and function optimally, be it in his workplace, be it at home. So the counselor takes a step-by-step approach in providing the needed help for the counselor, or for the counselee to be able to receive that desired help he is looking for. Now, the counseling process begins with yes, are we together now?
Your slide has
Yes,
come
we
up.
are.
Yes, sir. We can hear
Yes, sir. We are together, sir.
All right. So when a person seeks to seek counseling, I am saying that he or she must have suffered from a serious problem. It could be mental health issues. It could be workplace related issues. It could be emotional problems, or he may have had family problems that are troubling him, and he needs help from a professional. This process is not a rush process, but it involves a systematic evaluation that includes a detailed step-by-step process of helping the individual. Now, the counseling process involves a step-by-step approach, and the counselor conducts it in a way to make sure that his client is comfortable with the process. Are we on the same page?
Yes, sir, we're on the same page.
Hello?
Sir?
Hi.
Yes, sir. Hello.
Okay.
We are on the same page, right?
Yes, sir.
We're on the same page.
Hello?
Hello, sir.
Yes.
Hello, sir.
The network is giving me.
We are back again.
I have decided to share that's those slides with Fire to share it on your platform.
Yeah.
Very, very quickly, because once I want to connect, once I shift a little to get network to be able to share and have stability, the network runs off and it becomes a problem. So is that okay?
It is
Yes,
okay,
sir.
sir.
Very okay, sir. Thank you so much, sir.
Okay, so can we continue?
Very well, sir.
Yes.
Okay, so I was saying that in the counseling process, when you have a client before you, the first thing to do is to build a relationship. That relationship on engaging the counselee to explore issues that directly affect them. Now, if you don't build a relationship with your client, it becomes difficult for you to be able to get into their own world and understand the way they feel. Are we together?
Yeah, with you, sir.
Yeah, with
So
you, sir.
the first meeting, the first encounter, or the first interview is very, very important because the counselee is watching you keenly. The counselee is determining whether he can engage you or you can engage him or her. The counselee is also assessing whether you are trustworthy enough, for him or her to discuss with you. The counselee is also sizing you up to be able to understand whether you are trusted enough for him or her to hold discussions with you. So the first interview is very important because while you may think he is a counselor, is a counselee, and he needs problem, the counselee is also trying to size you up as a provider of help. So he's reading both your verbal and non-verbal messages. Of course, you know that communication takes place in two forms. It takes place verbally and it takes place non-verbally. So most of the times we ignore the non-verbal aspect of the communication. But the counselee, as he comes to you, he is also, watching you, taking note of your non-verbal messages, and making inferences between the counselor and the counseling between the counselor and the counseling process. Remember, the counseling is a process. So when you build a rapport, you are also building a relationship of trust so that you can be able to engage the counselor, the counselee, and provide help. Now, the counselor in this first engagement has to take note of the following steps in building a rapport and a relationship. He first introduces himself. You have a counseling office or you have a counseling section, and then a client walks into you, and you are just looking at the client without asking the client to sit down or introducing yourself to the client. Of course, the client will feel not welcomed. Are we together?
Yes, sir.
So the first thing is, as the counselor walks into your office, you ask the counselor, invite the counselee to sit down. He's coming to seek help, but good morning, you're welcome. Please sit down. Then you introduce yourself. I am Mr. Fayam. You're welcome. Please, how can I be of help to you? You are building a rapport. You are showing the counselor that he is welcome. You are telling the counselor that he is in the right place. You are telling the counselor that, yes, he can receive help from where he has found his or herself. Are we together?
Yes, sir.
Have you understood to this point?
Yes, sir.
Is there any confusion?
Not yet.
Not yet, sir.
There's no
So we can
confusion
make
yet, sir.
progress. So we can make progress, right?
Yes, sir.
Yes,
Yes.
yes.
You have already introduced, you have already welcomed your client. You have introduced yourself. Then the counselor, as soon as you introduce yourself, the counselor also in his response is going to introduce himself. Are we together? So after that introduction has taken place, ensure the counselor is comfortable. If the counselor is sitting at the edge of the chair, encourage her to feel free, encourage her to sit well and sit comfortably. She is comfortable. Give her assurance of comfortability so that she can be comfortable in relating with you. At the point the counselor tells you his or her name, you are going to address the counselor by name and not by any other nomenclature. You address the counselor by name. Now, you may also notice that a counselor coming to you is wondering whether you are going to judge him or her based on the situation that has happened around him. So he has mixed feelings. So he is tensed, he is anxious, and anxious about what will happen, anxious about the nature of the conversation, anxious about the outcome of that interaction. It is now expected that you may invite a social conversation to reduce anxiety. For those of you who watch football, for those of you who watch news, you may chip in a latest issue. You may find a way of connecting a latest issue, to that client's behavior of not being relaxed. The essence of introducing that social conversation is to reduce your client's level of anxiety, to feel comfortable, to feel at home, and feel free to share his concerns with you. So why you do this? Remember when the client came into your office, I told you earlier on that you establish a rapport, you create a relationship. Because the client is watching your verbal and non-verbal behavior to ascertain whether he can go on with his counseling or whether he's in the right place or whether he's in the wrong place. It is now also your turn to begin to watch non-verbal behavior of the client. It is possible your client comes into your counseling office or the counseling comes into your counseling office. He came in with his father or mother or wife or husband or an elder sibling or an uncle or an auntie. Now, when you introduce conversation and you notice your client peeling the nails and looking down, you know that the client is a non-verbal behavior communicating to you that I am not comfortable discussing with you in the presence of this person that is here. So the non-verbal behavior means a lot. So a very good counselor watches the non-verbal behavior of his counselee or his client and takes appropriate decisions. Have we understood this point?
Yes, sir.
Yes, sir.
Can I go
Yes.
ahead?
Very well.
Yes,
Okay,
sir.
so when you interact with your client, you allow them time to respond and indicate they are actually interested in the conversation and you are also interested in their conversation. So the indication of interest is a two-way traffic, depending on the counselor's skills and ability. Now, as you allow them time to respond, how do you make them understand you are interested in the conversation? You make them come to this point by making comments such as, yes, go ahead, I am listening. You have actually not concluded your discussion. I am listening. Can you go ahead? And as you nod your head as the client is talking, and as you interact You focus, you give attention to what, as you give attention to what your client is saying, it is an indication that you are actually interested in what they are saying. You are actually concerned about their own feelings. You are actually concerned about what has happened around them. Now, the second thing the counselor needs to do in the counseling process is problem assessment. It is called problem assessment. You assess the problem of the client. And this step involves the collection and classification of information about the counselor's life situation and reason for seeking counseling. For instance, a counselor comes to you, and he's coming to you because he has problems with the boss in the office, and that is affecting his productivity. And then you continue with your discussion after creating a rapport and making your counseling relax. And you continue with the problem assessment by saying, yes, Mr. Michael, feel free to discuss with me in honesty, in sincerity, and be open as much as possible. I assure you that whatsoever we are going to discuss here is going to remain within the confines of this office and our discussion. So I assure you that nobody is going to have an hint of what we are discussing here. But also in the course of discussion, Michael, I want you to know that I'll be asking you a lot of questions. They can be bordering on your personal life. They can be bordering on your functions in the daily functions in the office, in your department, and they can be bordered on your relationship with your boss. Now, you have prepared Michael as your client or the counselee to understand that you are going to do a problem assessment of what his problem is. And this may have border on asking questions concerning his life. Now, someone may be asking, which one do we start with? There is no particular order you are going to start with. You can start with anyhow. You can start with the personal life. You can start with the office life, depending on which one is more suitable for you to start. But when you come to do your proper documentations, then you begin to arrange your own problem assessment in order of importance. You begin from how you want it, the personal life, and it flows into the work life, to the end of the assessment or the end of the histories you have assessed or the issues you want to elucidate from your plan. Are we together?
Yes, sir.
Yes, sir, we're together.
Have you understood?
Yes, sir.
Have you understood to this point?
Yes, sir.
Yes, sir.
Have you understood? Okay. So the next, when you have done your problem assessment, the next thing is goal setting. You set the goals. You have now assessed your client. You have understood the magnitude of your client's problem. You have understood the direction that you need to set goals. The goals the goals set are addressing the issues that are being observed in the problem assessment. Now, in goal setting, we say that after a thorough evaluation of your client's problems, after a thorough evaluation of their problems, it is very important for you to set goals, considering the issues the client is facing. Now, if the client came because there are marital issues, you are setting goals that are going to address those marital problems. If they are bordered on the marital relationship, they are bordered on reconciliation. Your goals are geared towards reconciliation. If your client's challenges are academic in nature, the goals you're going to set are going to be goals that are directed towards enhancing his academic performance. If the goals are work-related, if the prop challenges are work-related, your goals are set towards enhancing his productivity in the workplace. So goals should be selected and defined with care, and they should relate to desired ends, and they should be defined in explicit and measurable terms. So as you go on with your intervention, you are measuring your intervention, the success of your intervention in relation to the goals that have been set with the client or in handling the client's challenges. Then the first step of the counseling process is called exploration. Here the client explores their thoughts, their feelings and behaviors, gaining insight into their challenges. Remember, you have done a problem assessment. You have set goals, and you are working towards achieving this goal. There is a point of evaluation. The client himself is beginning to look at some areas of his reaction, of his behavior that are incongruent with direct organizational goals or the family goals or the marital goals or the academic goals that have caused him his problems. So he begins to have an insight and understanding of his own challenge, of his own problem. And also at this point, some clients may also be thinking, oh, if I change to this way, if I do this thing, I should be able to live better, even before intervention comes. Then the fifth counseling process is the intervention. Here, the counselor helps the client develop new coping skills and strategies. Remember, in our definition, we say that it can be an individual, it can be a couple, it can be a family, it can be a group of co-workers. They have a problem and they are coming to seek help. Now, remember, as you did. Hello.
Hello, sir.
Are we
So
together?
we're here. Yes, sir.
Yes, we are here.
Sorry, sir.
Yes.
Could you please throw more light on that point of exploration, please?
Yes, sir. Sorry, sir. You said the first step is problem assessing. Second one is goal setting. Then the third one is exploration. So from this exploration, I didn't really get it. If you can actually help me, sir.
Okay. When they say somebody
The first one is
exploring,
building a rapport.
yes.
So
when you say exploration is derived from the word explore, isn't it?
It is.
When you explore, exploration means searching, can also mean searching. You are searching for something new, or you are searching to find a solution, isn't it? Now, in the counseling process, your client comes to you, he has a problem. You have done a problem assessment. You have asked him a lot of questions. In the course of problem assessment, the client is also assessing himself. He is exploring his thoughts to see where his thoughts were right or his thoughts were wrong. He's exploring his feelings. He's exploring his behavior. Perhaps he never understood that his behavior is a problem to him. Now he's beginning to get insight. Now that, oh, my actions, my problem is as a result of my actions or my inaction. But this comes from the exploration, because in problem assessment, you ask a lot of questions. You ask the client a lot of questions to have clear understanding of the why to his problems. Are we together?
Yes, sir.
I don't know if I've responded to your concerns now.
Yes.
Have I answered you?
Let me just be clear. Who actually explores here? Given the fact that actually explores here, the client or the counselor?
The client is also exploring his thoughts. The client is exploring his thoughts. The client explores their thoughts, their feelings, and behaviors, gaining insight into their challenges. Now, as you are doing a problem assessment, remember I told you counseling is a therapeutic alliance. It's a therapeutic relationship, isn't it?
A healed wound.
Yes.
Hello.
Hello, sir.
Hi.
Just like a chief man would say, that as they're exploring you, as they are assessing your problem, you are also doing an exploration of your own behavior, your own attitude, your own thoughts, and your own character, your own feelings. Is this feeling appropriate to this behavior? Are my thoughts actually correct? Are my thoughts wrong? But as the client explore his thoughts in the counseling process, he is able to have insight into his own challenges. He had a problem, but he's looking at the problem not from a holistic perspective. He has maybe the client has an external locus control, feeling that someone is the cause of his problem. But as assessment progresses, he goes to the next step, exploring his own thoughts. And he's having an internal locus. Feeling that having an understanding now that he can also be a cause of his problem. Are we together?
Yes, sir. I think the network has thrown the dog out again.
Yes. Please let me ask a question to the house. Please, the first one you said is getting reports or what?
You missed it. You missed it. The counseling process is number one, building a rapport.
Okay.
Number
Building
two,
a
problem assessment.
Okay.
Number three, goal setting. And then
Okay.
number four, exploration. Those are the four he mentioned so
All right.
far.
Thank you.
It's already break time now. So, Mr. Desmond, you can talk to him. He will fix his network. We'll come back by 1, if that's okay.
Due to the breakage in network, we should have his
Madam Julia, what did you say? Network didn't allow us to hear you well.
Okay. Okay. I suggest we should allow him to have the lecture till 1. Since there was a breakage in the lecture, let's see how it goes.
On the glitches, he should just make amends to his network so that he will come back officially by 1 now.
That's fine. That was my suggestion too.
Yeah, I subscribe to it.
Let me call him, class.
Please do. Hello.
Hi, sir.
Okay, so have you understood that point?
Yes, sir.
Yes, sir.
You were trying to explain intervention when network threw you out. So you can go on with it, sir.
Okay, so in the intervention, the counselor helps the client develop new coping skills or coping strategies. Remember, underline the word helps. The counselor here helps the client to develop new coping strategies, develop new coping skills, depending on the counselor's orientation. Now, the counselor is not going to develop a solution. He rather helps the client develop a solution. Are we together?
Yes, sir.
He helps the client develop a solution to his problem. Now, this solution is dependent on the counselor's orientation. And I say, for example, if the counselor believes in the person-centered approach, then the counselor gets involved rather than intervenes by placing emphasis on the relationship. Now, in the client-centered approach, the client is at the center of the matter. He is the most important. Now, if the client is able to understand the origin of his challenges, whether they are whether he has an internal locus control or he has an external locus control, or he is attributing his problems to external forces or attributing his problems to some of his actions or inactions, then he is able to develop a faster solution to his problems. So he is the one identifying. The counselor is guiding him to look at those problems and identify areas where he is falling short and amend appropriately. If the counselor's orientation is based on the behavioral approach or behavioral techniques, he is looking at his behaviors in terms of what behaviors that are normal and what are abnormal. And of course, you know that abnormal behavior is learned. And for you to deal or to do away with abnormal behavior, you must also unlearn them. So under the behavioral approach, the client is looking at behavioral characteristics or traits that have actually been a problem or a source of his problem. And he's understanding how he can unlearn these behavioral traits. But it is dependent on the counselor's orientation. So a counselor who believes in the behavioral approach believes that maladaptive behavior are learned and treating them means unlearning those behaviors. If the counselor believes in the cognitive approach, the cognitive approach focuses on the fact that our thought process are faulty. So for us to be able, for us to come back to normal and improve our well-being, then we must restructure our thoughts. But it is depending on the counselor's orientation. He guides, he helps the client to develop new coping strategies, but it is dependent on his own orientation. Is that point understood?
Yes, sir. Please, I don't know if I can make. I just want clarity
You can
on
go
something,
ahead.
sir.
You can go
All right,
ahead.
sir. On this intervention, I don't know if by chance you are trying to say that because you made a statement. You said that the counselor does not develop a solution. He rather helps the client in coming up with solution to the problem. So are you by chance trying to say that after building a report, getting the problem, assessing it, and then setting the goals, then after the exploration, you've already assessed the challenges and the problem from him. So you are now going to ask him that from this problem that you've assessed or you've seen that is from you, how do you think, what do you think are the possible ways you could at least sort it out? Or is that the approach, sir?
Okay. That's it. That approach significantly differs from what you have said. You have, as you are exploring, as you are assessing the problem, the client is exploring. Are we together? He's exploring his own thoughts, having insight into why those challenges came. The counselor, in the process of problem assessment, is also helping him come to a point that this is the relationship between this problem and your present state. Are we together? Causal relationship. He's assessing him, doing an in-depth assessment, and also doing a causal relationship analysis. Now, at the end of the day, he asks the client, it's an interactive, it's an interaction. He asks the client whether he understands that there are certain things he has done or some of his traits are linked to some of these problems. Are we together? Now, for instance, you have before you a client who has come to you to tell you that each time he's finding it very difficult to cope. So in the course of your problem assessment, you discover that he has chain of friends that he wants to satisfy everyone, so he doesn't have time to read. Now, in the problem assessment, you are asking him, how many hours do you read? He's telling you, no, I read just an hour a day. And you are asking him, you read, okay, could it be that you are engulfed with other activities? He says yes. And you say, can you go ahead can you mention some of these activities that are also very important to you? And he starts telling you that, my friend John, every day we ask me, let's go and play ball. When we play ball and finish, James, we say we should go and watch film. And then you are asking, at the intervention point, you are asking the client, how do you look at these activities in relation to your inability to perform well? And you see the client will be telling you that, look, I have seen that going to watch film and play football and doing that at the expense of my studies is actually affecting my performance. Are we together?
Oh, yes, sir.
Now, the counselor is asking the counseling. So, how do you think, or what best approach do you think this can be resolved? Then, if the counselor is a behaviorist, he is telling you that because you are so much attached to James and John, he will be guiding him to see why he has to detach himself from James and John. Are we together? Hello?
Yes, sir, we are together.
Hi, sir.
Have you understood that point? Have I answered your question?
Yes, sir.
It's right. Can I make progress?
Yes, sir.
Can we make progress?
Yes, sir.
Yes,
okay,
sir, we can make progress.
Then you get the sixth step, which is evaluation. In evaluation, the client and the counselor assesses the progress of their interaction. Then they make adjustment the treatment plan as needed. Remember, the counselee is not going to remain with you forever. He's also going to implement some of this. He's going to go and implement the treatment approach, isn't it?
Yes,
so,
yes, sir.
Evaluation is not done on the same day that you have done your counseling and you've done your own intervention. The client goes back, and as the client is coming back for follow-up, you are doing an evaluation to assess the progress. Has the client been able to make adjustments? Has the client been able to adhere to the treatment plan? We're talking about adherence because the client and the counselor and the counselee together have developed a treatment plan. So you evaluate, you measure to see if he's actually doing what he's supposed to do. Then you come to the end point of the counseling process called the termination phase or termination. Here the counseling relationship comes to a close, with the client having achieved their goals or developed the skills to continue growing independently. Remember, in the definition of counseling, we say that a counselee has a problem. It could be on individual basis, it could be at a family level, it could be at a couple level, or it could be at the organizational level where he works. He is coming to seek help to be able to overcome what his problems are and be able to function optimally and independently as the case may be. Now, you have followed through the counseling process. You have actually built a rapport with your client. After building a rapport, you have been able to also assess your client's problem. You have set goals to achieve based on the problems you have been able to identify. You have the client is able to explore his own thoughts and feelings. You have intervened. Then you did an evaluation and you are satisfied with the level of progress. Then the counseling session comes to a close. And that closing is what we call termination. That relationship ends after achieving the goals that we have set. Is that okay? Or is that understood?
Very clear, sir. Very clear.
Okay, so can we move forward?
So I have a couple of questions.
Okay, a couple of questions. Yes, can we take them?
All right, sir. Thank you for the opportunity. A form of critique in my head, I am just having in my head, which I need you to throw light on it so that I will be on the same page with you. You mentioned that after problem assessment, you talk about exploration, where the client begins to explore the situation as the counselor engages him or her. He examines the situation to actually identify loopholes, possibly the case at hand. So in my personal evaluation of that expression, I am looking at it that there may be situations where you have because it's not a counseling session that you have clients who are same. Some really not needing application. Their thought process may not be very.
Your network is actually breaking, seriously breaking. And I'm finding it very difficult. I said your network is seriously breaking, and I'm finding it very difficult to follow up with your question to provide an appropriate response.
Sorry, sir.
Okay, I can hear you clearly now. Yeah.
All right, sir. You mentioned that after problem assessment, you move to the client explores within itself, given what has been presented the counselor to also find out possible root causes of the problem at hand. And I'm just having this feeling that there may be scenarios where the client may be disillusioned, may not really be mentally stable, because from experience, it's not in all cases that you have who are needing help that are coordinated in thought process. So if a client who is disillusioned psychologists from each perspective are present to you, that kind of present to you facts. You see, how do you evaluate that kind of a case? And then I think that's one. Then the second question is, having itemized all that you have mentioned in a counseling section, you say that the communication point now. The question I want to ask is, must the set goals be achieved in a counseling section within a particular council?
Hello.
Hello, sir.
Yes.
Or maybe I should take the question one after the other.
Okay. Let me respond to the first question.
Okay,
now,
sir.
Counseling is a process. So someone who is not mentally stable is not fit for the process. But a caregiver to someone who is mentally ill may be overburdened with the process of caring for an ill person. And he may come to seek help to overcome the mental stress or the challenges he is experiencing in taking care of the client, a patient. Evaluation can take place. But evaluation cannot take place in a mentally unstable person. It therefore also means that a mentally unstable person is not fit for a counseling session. Is that understood?
Very well, sir. Very well, sir.
So, second question.
Okay. The second question is, when you are talking about interaction, you mentioned the counselor's perspective. For instance, you mentioned that if the counselor is a behaviorist, given what the person, the client come up with, the judges based on his behaviorist theories or perspective. So I want to ask, is it actually in the counseling section, is it actually appropriate to judge based on the counselor's perspective or on the symptoms presented?
Okay, I didn't say judge, but I say that the counselor's intervention, is that okay?
Yes,
or the counselor's help will be in line with the counselor's orientation.
So I think that's where I think maybe I don't understand that expression properly, but I think that's where
the counselor's orientation. Now it's just like what was your first degree? What area did you have your first degree in?
Philosophy.
In philosophy, isn't it?
Yes, sir.
What are the branches of philosophy that you can specialize in?
Ethics. Philosophy.
You can specialize in ethics, yes, one. Pardon?
Metaphysics.
Metaphysics.
Yes, sir.
Now, a person who specializes in ethics and is counseling an individual will not counsel him using the principles of metaphysics. True or false? Hello.
Question. Yes. I got
Hello?
that. Yes, he would definitely use his own ideologies from the. Hello, sir.
His own ideology is what we are calling orientation, his area of interest.
Yes, sir.
Have I answered you now?
Yeah, you have. But my question is, what if ideologies are not aligning with the situation that is presented? What is the place of referral? Maybe I'm not preempting, but then I think, is it not, is there no situation whereby if what is presented does not tally with what is available, say based on the counselor's orientation, he does not have solution to what the client has presented? Is there no other alternative? Must it be from his own orientation?
No counselor will counsel a patient from another person's orientation. All orientations aligns with the client's need. But we are saying that the treatment approach is based on his own conviction. And for every conviction, you are jumping to mention referral. But even when the issues are aligned with your orientation and you cannot help the client, you refer. But first, the counselor attends to or intervenes in a client's situation based on his own orientation. There is nothing wrong with the counselor's orientation. If the counselor's orientation is the person-centered approach orientation, he puts the client at the center of the problem. And he sees that the problems are addressed. If the counselor is a behaviorist, he sees the client's problems from a behaviorist perspective. If the client is a cognitive, is from the cognitive perspective, he sees the client's problem from the cognitive perspective. I don't know whether you have understood me.
Sir, you are very clear now, sir. Thank you. It's clear now.
It's all right.
Thank you.
So can we make progress?
Yes, sir.
So we have been talking about counseling, and we are mentioning counselor. Who then is a counselor? And by way of definition, we are saying a counselor is a professionally trained person who provides guidance, support, and therapy to individuals. It can be groups, it can be families, to help them cope with mental issues, relationship problems, or other challenges. So a counselor is not just anybody. It is not just an honorable, it's not an honorable politician. It is somebody who has been trained and has been equipped with the skills, he has been equipped with the knowledge, he has been equipped with the capacity to provide guidance and support. It could be therapy, it could be a treatment support to individuals. It can be an individual or individuals. It could be to groups, it could be families, and the aim is to help them cope with their mental issues, cope with their relationship problems, or other challenges as are brought before him. So for everybody who aspires to be a counselor, he must possess certain skills or certain qualities. Are we together?
Yes, yes, sir.
Have we understood that definition of who a counselor is?
Yes.
So there are certain qualities counselors must possess. And the first quality is empathy. Empathy. Empathy means putting yourself into the shoes of others, putting yourself into another person's challenge, having an understanding of what is happening within an individual's inner mind. Are we together?
Yes, sir.
And this quality is very essential in establishing trust and building rapport with your patients or your clients. Are we understanding?
Yes, sir.
So counselors can draw on some industry best practices to express empathy to patients, such as the patient is saying something and you have not heard the person very clearly, or you heard but you want to be sure this is what that client is saying. Now, You will repeat what the patient has said in your own words to indicate a clarity in understanding to avoid misunderstanding. Okay, you say this. Is this actually what you meant?
Okay.
Are you understanding?
Yes, sir. Wow.
You say this, you are, as the client is talking, you heard the client, but you want to be sure that what this client say, this is the meaning. You know, words have different meanings in the context in which they are used. So you rephrase your understanding of what the client is saying, and you ask the client, is this what you actually meant or you mean? And the client says yes, and then he continues.
No.
So when you do these things, you are validating a patient's feelings whenever possible. And you are also allowing your patient or your client the time they need to open up and share information. Are we following?
Yes, sir.
So a good counselor develops empathy, the skill of empathy. He empathizes with his client. He understands how the client is feeling. He understands with the client how the client is feeling in order for the client to be able to open up to him. So when you don't empathize, the client feels that, oh, you are judging me already, so he will not talk. He will not have confidence in the counseling process. Is that okay?
Yes, sir.
The second quality a counselor must possess is the quality of effective listening. Effective listening. The client has come. In our definition of counseling, we are saying that he is looking for somebody to provide help. Now, you are there, he has come to you, and he wants you to actually help him. And then he needs you to give him or her a listening ear. He needs you to give him or her what? A listening ear. So when you don't listen to a client, when you cut the client, you know, the client loses confidence in the ability of the counselor to help him or her. So a good counselor listens to his client's side or narration of his problem immediately. Once you fail to listen, it is difficult for you to get to the next step of counseling.
That's true.
So a good counselor must be one who is also a good listener. He pays full attention to the client's issues and he takes note of every detail of what the client is saying. Is that understood?
Yes, sir.
Good. He must also be a good communicator. He must be a good communicator. He must be a good communicator. A counselor is someone who listens to his client. He analyzes the client's problems. He develops a plan of action to achieve a target. And it is indeed critical to be a very good communicator to help the person feel comfortable around him. And make sure that the client is not hesitating while speaking in front of him about his problem. So first, in the process of communication, the counselor is also building a relationship. He's also building a relationship. So when you communicate with your client, you are building a relationship. You are not just talking, you are also building a relationship. You are helping him or her, to feel comfortable opening up to you and sharing his own concerns with you. Are we together?
Yes, sir. Yes, sir, we are together.
Is that point understood?
Yes, sir.
Then here comes also another important quality of the counselor. He must maintain confidentiality. He must maintain confidentiality. A client is reluctant. A client is reluctant. A client is reluctant to open up if he does not trust the counselor. And trusting the counselor building trust begins at the very point the counselee enters the counselor's office. If the counselor is the type that talks too much, the client is afraid to open up. If the counselor is the type that allows people barge unnecessarily into the counseling session, the client is afraid. The client wants his information to be kept confidential. So it is the responsibility of the counselor, to make the client feel safe and secure, sharing their personal concerns with you as a counselor. So you have to build trust. And confidentiality begins through the process of rapport building. You build a rapport, you assure and reassure the client of the safety of the information he's going to share with you.
Safety of information.
So even if you know the counselors or the counselee's relations, that information is not going to be shared. Even if the counselee is your own relation, that information ought to be kept confidential. And for every counselee's information that you have to share, you must agree with your counselee on who to share the information with and how to share the information and what information to be shared. And I tell you, even between the husband and the wife, you don't divulge information to any of the party. You must agree with your client. Now, there are the few instances or the only instance where you can share, or a few instances, it's when that information poses a security threat either to the counselee or the society at large. So you explain to the counselee why this information ought to be shared, because it is for the improvement of his well-being or it's for the security of the society and the people generally, including himself. Is that point understood?
I have a question. Sorry, I actually have two questions before you proceed.
Okay, you have a question, yes.
Yes. So my first question is on the aspect of this empathy. You say empathy means putting yourself in the shoes of your client. And you also went ahead to say that it involves you trying to rephrase what the client are actually saying. And then by rephrasing it, it helps you to actually get the emotions behind the statements, right?
Empathy means having a feeling of the client's problem.
Yes.
Having an understanding. And I'm saying that one way you can develop empathy is by rephrasing what the client says, so that you'll be sure that you are actually following and you actually understand what his problem is.
Thank you, sir. That's what I want to ask question from. So what if this is your client in question now, is someone who is not well educated or well informed, someone who speaks in his or her local dialect, how will it be possible for you to rephrase it, even though you understand it?
We have not even said that. We have not even said that counseling must be in English language. Have we said that?
No, not really, sir.
Hello, talk to me now.
Not really, sir.
So, if it does not matter what language the client understands, if you have a client who cannot speak the language you can speak, then you refer that client.
Wow. Okay. My
And
second
if
question is
the client can listen, the client cannot speak your language and cannot speak English. Then you refer that client to a counselor who understands the client's language. Yes.
All right, sir. My second question is on the aspect of confidentiality. So I want to ask, during the counseling session, is what if I want to use a recorder, even if it's not really lead to observation and maybe I don't think it's done well, just for me to really to evaluate the whole process again. Will it be, is it appropriate?
Okay. You will have to seek the consent of your client. And if that client agrees with you, you can use the recorder. But where the client does not agree with you, you cannot use the recorder. Using a recorder also instills fear and reduces and makes your client refuse to divulge certain information to you. So it is important that you have a pen and paper and you tell your client these issues we're discussing here. I will really need to note them down. And as such, I will note the important points so that I don't forget, that I will be able to make reference to them. So the client agrees with you.
All right, sir.
Yes.
My last sorry.
Yes,
So my last question is, for instance, and I have a patient who is just 7 years old, and then this patient was brought in by his or her parents, and then from what the counseling session, the result of the counseling session is something that, okay, not really something I'm supposed to tell to the parents, but the parents are really asking of how far with you, so they want to know. But because this person is a child, is it not okay for me to open up to the parents? Must it, because I don't think this person is an adult for me to hide anything from the parents?
As a counselor, don't underestimate in any way a client before you. Now, the parents brought that child to you, isn't it?
Yes, sir.
And there was a referral question. There was something they wanted you to do for the child, isn't it?
Yes, sir.
You respond to the referral question. Oh, this child is being stubborn. If there are other incidental issues you have found, they are tied to the fact that they have triggered the stubbornness. And if you answer the question of the referral question. But if you want to expose some other factors, we call them incidental factors that you have discovered to have been a problem, you discuss them with your client. As young as the client is, let the client give you consent to share this information with the parent, except in areas where those consents are going to negatively affect the client's well-being, further well-being. You may explain to the client to understand why it is important for you to share this information with our parents, his or her parents. But don't underestimate any client that comes.
All right. All right. Thank you, sir.
So just a follow-up on that, please. Hello, sir. Hello. Hello, sir.
Are we together? Yes, sir.
Yes, sir. I wanted to have a follow-up on
Hello.
that, please.
Are we together?
Yes. Yes, sir. We are with you, sir.
We are with you, sir.
Are we still here?
Yes, we are here.
Mr. Jiba,
Are we there?
Yes, sir. Well, yeah.
Hello?
Yes,
Yes,
Okay.
sir. Well,
yes.
So can we continue?
Here, question
Can we continue?
on that.
Yes,
Yes,
sir.
sir. But I wanted to have a follow-up question on that confidentiality, sir.
Okay.
All right. My question is, in a situation whereby the client's problem seems to be coming from a third party, for instance, a child who is facing depression and is taken for counseling, and it's discovered that the depression is actually caused by the parents' attitude, maybe the parents' treatment and all of that, and then maybe the parents are narcissistic and all of that, they maltreat the child to trigger that depression. Then the counselor tries to talk it over with the parents, and then the client is afraid of what may happen. Maybe after telling the parents will get home and say, okay, sure, you have gone to report us now, you will see shaking in the house, something like that. Now, what would be the approach to end that problem?
As a counselor,
Yes,
as a counselor, um, as a counselor, your role is to provide correct and consistent information to the parents or to the client to improve their well-being. Now, you're bringing the parents together is not to report that the child has said this about them. It's to bring them to a point of understanding that yes, there are concerns that are being raised here by the child. And from these concerns, this and this and this are what you have seen to be the reason. You provide counseling in a family counseling session to the parents to understand how their behaviors have impacted negatively the well-being of the child. Now, if such things further persist, if they further persist, you are providing also correct and consistent information to that client, so they can know the channel of reporting further issues that relate to abuse. So the client will be enlightened on what to do in case abuse persists.
Okay, sir.
I don't know if I have responded to you.
Yes, sir, you have. Thank you, sir.
Okay. So we are talking about confidentiality. A counselor must not have diarrhea of the mouth. He must keep information from his clients confidential. How do you maintain confidentiality? The first step to maintain confidentiality is to have an informed consent, to inform your client. Counselors must inform their clients about confidentiality and its limits. You will explain to your client what confidentiality is and how it is maintained, and the limits to which you can keep confidential certain information that have been divulged to you at the onset of the counseling session. Because confidentiality has a limit. If you have a client to you that has made unsuccessful suicidal attempts, you don't keep such information confidential. You make your client understand that in such situations, we cannot keep this kind of information. It is for your own safety. Another way a counselor can maintain confidentiality is to secure the records of the client. You must secure confidential records such that unauthorized persons cannot have access to them. Then you must be discreet in communication. You must use your discretion when communicating with others, not taking your clients' situations and using them as examples to make people understand certain situations, certain things. Are we together?
Yes, sir.
And then the counselor must be culturally competent. Now, you may have people from different cultures. So one thing that is acceptable in your culture may not be acceptable in another culture. That does not mean that maybe what is acceptable in your not acceptable in your culture is acceptable in your client's culture, and then you want to make it look as if the client has done something wrong. No, you must be culturally competent to understand cultural variations from one culture to another in the course of counseling. And being culturally competent means that you must be culturally humble to accept that, oh, this culture behaves this way. So you approach your client with humility, acknowledging the limitations of one's own cultural perspective above the other. Are we together?
Yes, sir.
So how important is cultural sensitivity to counseling? It improves client's engagement. When you understand a client's culture and you know that there are cultural differences, you will notice that that client will be able to relate with you in trust, and you are able to build a rapport with your clients from diverse backgrounds, and you are able to help them with their own challenges. And then it also increases effectiveness. The counselors who are truly culturally sensitive can better understand and address clients' unique needs and concerns. When you don't have cultural biases, it enables you to address your clients' unique concerns, and you help them and improve their well-being. And that also reduces disparities. Mental health disparities, it improves outcomes for underserved populations. Is that understood?
Yes, sir.
Are we on the same page?
Yes, sir.
Yeah?
Yes, sir.
Yes, sir. Please, can you take the first point again?
Pardon?
Sir, can you take the first point again? You said it helps to address your clients. Can I didn't hear you well, sir.
Okay, I said that a counselor who is culturally competent, if he is able to improve his client's engagement by building trust and rapport with clients from diverse backgrounds. And when he is culturally competent, it increases his effectiveness in his counseling skills or his counseling work. He addresses his clients' unique needs and concerns. Because these needs are unique. They are culturally unique. They are not same with your culture. And thirdly, I said that it reduces disparity. That it helps improve, it helps reduces mental health disparities, and it improves outcome from clients who are coming from underserved populations. Now, the issue of being culturally sensitive is very, very important in counseling. Now, a counselor who is not culturally sensitive can improve his cultural sensitivity through self-reflection. The counselor himself engages in ongoing self-reflection to recognize and challenge his own cultural biases and assumptions, so that he will not be allowing his biases influence his counseling outcome.
He must also adapt cultural assessment strategies. He must do a cultural background to understand his client's cultural needs and experiences. And he must adapt techniques that he can use in elucidating information from his own client. Is that okay?
Yes, sir.
So, another quality of a good counselor is non-judgmental. The counselor must not be judgmental. He must not judge his client based on the client's challenge or based on the client's weaknesses. He is expected in the course of the counseling session to be neutral and help the client come out of his problem. So as much as possible, a good counselor avoids asking questions like, you wouldn't have these problems if you have acted differently. How could you be that irresponsible? What were you doing there at that point? You know, there are questions that demean a counselee and blames the counselee and makes the counselee lose his self-worth and his self-value. Are we together?
Yes, sir.
So he must develop empathy. A good counselor must develop empathy. He must not hurry a client so that that client should leave. No. Another quality is that a counselor must be honest. He must be honest. Honest to his own weaknesses, honest to his own skills. Now, this is where the issue of referral comes in. Now, if you are only good in assessment and not in intervention, after assessment, after problem assessment, refer your client to where he can get good intervention. You don't need to keep your client longer than necessary. You need to refer the client where they can get help and come out of their own challenges. Is that point understood?
Yes, sir.
Have you followed to this point?
Yes, sir. We have been following.
Please, sir. This
Yes,
issue referring issue of honesty and then trying to refer. So what if because I feel one of the major reasons why anybody is doing what he wants to do is to have a good source of living, even if some things that comes with passion. So in a case whereby the counseling session is able to cost the person like 100,000 naira, and then you've done to a particular extent, are you just going to just send the person to another person without you splitting money into two? Or, I'm sorry for asking this, but it's very important. I just want to know.
In charging for sessions,
yes,
when you charge a client for a session, it starts from entry phase to termination phase. In between entry and termination phase, there is intervention, isn't it?
Yes, sir.
Now, you are not good at intervention, so you must not collect what is meant for intervention. So you are honest to your client. You must be honest to your client to tell them that, look, I need to refer you to where you can get the best intervention. Because I am referring you, you are no longer going to pay the initial fee of 100,000. You are going to pay a fee of 40,000 for what we have done so far. Are you not honest? Hello.
Yes, sir.
Is that not honesty enough?
Yes, sir. It is.
Yes, it is, sir.
It is, sir.
So, in counseling,
There are tools that are used for. There are tools that are used in counseling. And there are several of them that a counselor can pick from the counseling toolbox to use.
I wanted to ask a question.
You want to ask a question?
Yes, sir.
Okay, I'm all ears. Go ahead.
Sir. Sir, can you hear me, sir?
I'm with you.
Sir, this is a very interesting lecture. I am very, very glad to be in this class. Sir, there's something I wanted to get clear, sir. Can you throw more light the difference between a counselor and a counselee? I want to know the difference between those two concepts, sir.
Okay, a counselor is the
Yes, sir.
one providing help. Is the professional providing help.
Okay, sir.
The counselee is the person who has a problem and is seeking for help.
Okay, sir.
Yes.
Thank you, sir. Thank you very much, sir.
You're welcome. You're welcome. So there are tools a counselor can use. He can pick them from the toolbox and make use of them. And the first one is what we call we refer to as ask questions. Asking questions. You can pick the tool of asking questions. How to ask questions. If you don't know how to ask questions, you may ask questions that may not, provide insight into your client's problem. When you ask yes or no questions, they limit your understanding of the client's problem. Another tool is what we call active listening. The third one is what we call encouraging body language. The fourth one is paraphrasing. We'll take them one after the other to enable you understand these tools and how to use them. And we'll take the first one, asking questions. How do you ask questions in a counseling session? You ask open and close-ended questions. Open and close-ended questions is an important tool in the counseling kit that a counselor can use at any point in time. So they help a client to open up or close down. When you ask open-ended questions, they give the client the room to elaborate on his own problems. They are not simple yes or no questions, but they require that the client speaks. He provides insight into other aspects of his life that are shielded away from the counselor. So it is an open-ended question is one that is used in the counseling process to gather a lot of information. The counselor is asking it with the intention of getting a long answer and not a short no answer. And they are very good questions to start information gathering, to start with at the information gathering stage or problem assessment stage. These questions keep the client talking. Are we together?
Yes, sir.
Yes, sir.
Then active listening. So let me pause and ask you this question. Based on what is learned in this course now, how can you describe how to be an active listener in a counseling session? We have discussed active listening. We have mentioned it before. How can you be an active listener?
You can actually be an active listener by making sure that your consciousness is actually there at the moment. You're not present there. Meanwhile, you're thinking of something different. And then secondly, one way of actually paying close attention, being an active listener, is actually jotting down some of the key things that this person is saying. So you just makes you to be there.
Okay, you say putting down some of the things that the client is saying. Will you actually be writing copy notes?
Sir?
Will you actually be copying notes?
No, just points. I'm talking about points.
I also want to say something, sir.
Yes.
You can also be by
Hello, sir.
nodding head. Just
Okay, by
gentle
nodding, yes.
and then
Hello, sir.
making something like, okay, yes,
Okay.
go on. Something like that.
Refreshing, refreshing. It's one of the this active listening.
It's okay. Yes, Ralph, you wanted to say something.
Hello, sir.
Yes. Hello, Ralph. I'm with you.
No, it's not Ralph. This is Simeon, sir.
Okay, Simeon. Yeah.
Yes. Being an active listener is giving keen attention while your client is giving the explanation or trying to tell you what his problem looks like. Then you give attention. You do more of a listening at that moment. You don't ask questions. You give keen attention and listen to everything the client has to say before doing any other thing like asking questions or doing so.
Yes. You have
Can
to.
I try, sir?
Yes, sir.
Yeah. Then go ahead.
Okay. Being an active listener, just like Silvio just said now, is for you to pay detailed attention to every aspect or whatever the client is saying. And then secondly, to show an empathy when the client is narrating his or her story to you, where there is need for you to show an empathy, you show an empathy by, you can do that even through the body language, by gesture, nodding your head in agreement with the person that yes, indeed, the person is talking to you, and you are getting the message rightly. By doing that, you become an active listener. Thank you.
That's very correct. You know, the aspect of body language is very, very key. The aspect of body language is very, very key. Now, in active listening, you take note of the body language. And why we were looking at the stages in counseling, and we were talking about the entry phase, the emphasis was on the fact that the client also is watching the counselor's body language. He wants to know whether he is one he or she can trust. He is one he or she can, whether he can continue with the counseling session with this counselor. You know, the counselee is also sizing you up. He's watching your body language. Are you composed? Are you not composed? And all of that. So it is expected that in active listening, you must empathize with the person. You may also exhibit body language that will communicate to the client that you are actually empathizing and you are listening to what his concerns are. It makes the person or the client has confidence, in the counselor's ability to handle his or her own needs. Thank you very much for that contribution. So can we make progress?
Yes, sir.
So we are looking at tools that the counselor can utilize. And say before you begin the session as a counselor, make sure your physical needs are taken care of. Hello.
Make sure your physical needs as a counselor are taken care of. Make sure you drink water if you are thirsty, so that you will not disrupt the counseling session by going to take water or talking and sipping water. You know, the client feels that, oh, you want to show him that you know how to take water. So, me, I'm not going to come for the counseling session again. You give an appointment and they don't show up. Make sure you satisfy your hunger needs. Make sure you satisfy your bedroom needs. Going to urinate, going to defecate, and all of that. Take care of those needs so that they don't become a Are we together?
Yes,
Are we
sir.
together?
We're together. Yes, sir. Yes, sir.
Now, in the course of counseling, look at the client. Maintain occasional eye contact. Occasional eye contact simply entails that, yes, I am here with you, and I am listening to you. I am understanding how you feel. Then watch your body language. Now, as a counselor, watch your body language as much as you are watching your client's body language. And remember that communication is 55%. Communication is 55%. What you speak with your words is 55%. 38% is body language. Then tone and your other words are just 7%. Sorry, your communication is 55% body language. 38% is your tone, and words is 7%. Are we together? So your body language speaks volumes than you can ever imagine. So remember in the counseling process to encourage the client to continue with short, gentle comments like, oh, when he says something that is painful, you also say, oh, meaning I am understanding how you felt or how you are feeling. Really, to express surprise, just as the client is also being surprised or telling you as it actually was. Oh, tell me more. It means I am listening. But also in the face of all this, as a counselor, watch your tone. Watch your tone of communication. Is it high? Is it low? Is it loud? Is it soft? Is it accommodating? Is it demanding? Is it fast? Or it is slow? All this can impact negatively the counseling process. And the last tool from the toolbox is paraphrasing. Here, the counselor will restate succinctly, and tentatively what the speaker said, conveying empathy and acceptance and genuineness. Oh, or is this what you really meant? You have paraphrased the client's statement. Is this really what you really meant? Making sure the client understands or observes that you are actually following every bit of your discussion. Are we together?
Yes, sir.
Is there any question?
Sir, is there any difference between advice and counseling?
Yes, there is. They are actually not the same, because in counseling, you don't advise.
In counseling, the counselor provides correct and consistent information for the clients to make informed decision or choice.
That's true. Can we say advice, a counselor from the lookout of things, counseling can be a planned event or thing, but in advice, it cannot be a planned issue. How do you justify that?
That what?
That from the lookout of things, counseling is a planned event or issue, but advice is not. Is that possible?
In counseling, you don't advise. Whether they are planned or unplanned issue, you don't advise in counseling. Once you begin to advise, it's no longer counseling.
Okay.
So you don't advise in counseling.
Okay.
In counseling, you provide correct and consistent information. And that is why for the definition, we say you guide. You
Has network thrown dog out again?
Simeon, that is what is happening.
It's
Are we
already.
together? Pardon?
Yes, we are together, sir.
Okay,
Yes,
I
sir, we
will.
are.
Because we didn't start on time, I will crave your indulgence to stop by 1:30, so that when we come tomorrow, we'll take the other aspects to discuss, and then we'll round up from my end, isn't it?
Yeah, it's a problem, sir.
Thank you very much, sir.
Okay, thank you. I want us to look at types of counseling. There are
question,
different
sir.
types of. Yes.
Sir, please, in paraphrasing, I didn't actually get the explanation well. In paraphrasing, what do you say to your client, sir?
Okay, maybe the client is telling you a story. That why?
Sorry?
Maybe in paraphrasing, a client is telling you a story and he's narrating his problem and he said, why we were quarreling. While we were quarreling, I stretched forth my hand and then he said I slapped him. And you want to understand, the client doesn't want to tell you he slapped him. And then as a counselor, you ask, do you really mean when you stretch forth your hand, you slap him?
It's all right, take him, sir. Okay.
I will make progress.
Yes, sir.
Yes, sir. Yes, sir.
Okay, so there are different types of counseling. In the definition of counseling, we say that people can come to the counselor as individuals, they can come as couples, they can come as a group.
depending on what their problems are. So basically, we'll look at a very few types of counseling. And the first one is individual counseling. In individual counseling is a personal opportunity to receive support and experience growth during challenges or during challenging times in life. So individual counseling, can help one deal with many personal topics in life, such as anger, depression, anxiety, substance use and abuse, marriage, relationship challenges, parenting problems, school difficulties, and career challenges. Now, it has to do with an individual counselor dealing with an individual or relating with an individual counseling. That is why it's called individual counseling.
So would you please take it again, sir?
That individual counseling is a personal opportunity to receive support and also to experience growth during challenging times in an individual's life. And in individual counseling, the individual can receive help to deal with personal issues in his life. It could be issues of anger, it could be issues of parenting, it could be problems with school, it could be problem with career, it could be anxiety, it could be substance use or misuse or abuse, it could be marriage, it could be relationship challenges. But just as the name implies, the counselor deals with the individual counseling. It's one-on-one session. And then the next type is couples counseling. Here, you know that every couple experiences ups and downs in their levels of closeness and harmony over time. And this can range from basic concerns of stagnation to serious expressions of aggressive behavior. So in couples counseling, the counselor has or holds sessions. The counselor holds sessions with the couples. And the aim is to help them, overcome challenges in their own relationship. Or is to help them resolve conflicts, heal wounds that have existed that have given room for conflict. But over above all, couples counseling can help couples slow down their spiral and re-establish realistic expectations and goals in their journey together. Is that okay?
Yes, sir.
And then the next type of counseling is what called family counseling. This takes place, this is often sought for due to a life change or stress that is negatively affecting one or all areas of family closeness. It could be family structure, it could be the rules and roles in family, it could be communication style within the family. And this mode of counseling can take a variety of forms. Sometimes it is better to see an entire family together for several sessions. At times, it's to see some members of the family together. And in this session, common issues are addressed. Issues that are bordering around parenting style, siblings conflict, loss of family members. When family members have lost a precious one and they are grieving and they have grieved beyond the normal grieving period, they seek help. when new members are entering the family. You know, for instance, a couple that is married and suddenly have a child, you know, certainly roles are going to change. And the change in roles and responsibilities begin to create crises within the family. The family members can see a counselor to help them overcome these challenges. So every move or every major thing that affects or generally affects the family system is brought to the family counseling table, where the family seeks help and also receives help. Are we together?
Yes, sir.
Yes, sir.
And then the last one is called group counseling.
Sorry, sir. This one. What's the name of it? Is it
Family
counseling?
counseling. Yes. Then group counseling. Group counseling allows one to find out that they are not alone in their type of life challenge. So to be involved in a group of peers who are in a similar place not only increases one's understanding of the struggles around the topic, but also the variety in the possible solutions available. So in group counseling, there must be a homogeneous group with a homogeneous characteristics. They have the same thing bothering them. A group of teens go for counseling to address issues that are bothering, you know, on the adolescents. A group of science students go for counseling bordering on issues around a particular subject or a particular topic or a particular issue affecting them as a group. So typically in group counseling, you may have up to 8 participants in one group, and you may have 1 or 2 group leaders, and their discussion revolves around a common topic that affects them as a group. It could be anger management. It could be issues bordering on self-esteem. It could be issues bordering on divorce. It could be domestic violence. It could be recovery from abuse and trauma. It could be substance abuse and recovery. It could even be a health challenge that affects a group of people and they want to seek, you know, help. This group can come together as, you know, a group seeking help from a counselor. Is that understood?
Yes, sir.
Yes, sir.
Okay. Is there any question?
Yes, sir. So I have a question.
Yes.
Sir, can 2 or more counselors participate in those types of counseling?
No, one counselor participates in this type of counseling.
Okay, sir.
Good afternoon, sir.
Good afternoon.
So in the counseling process, which tune that is advisable for the counselor to use? Is it the low tune or the high tune, or which one that is advisable, sir?
The counselor will use a low tone. When you use a high tone, your client feels that you are scolding me, isn't it? Isn't it?
It is, sir.
So you use a low tone to counsel your clients.
Okay, thank you, sir.
You're welcome. Is there any other question?
Yes, sir.
Yes.
Sir, yes. Sorry, sir. Sir, are you saying from this class we're passing through now, is this lecture actually applicable now as from today? Can we actually counsel people out there now from what we have been taught?
Yes, when you apply the skills appropriately, why not?
Okay. Okay. It's all right. Thank you, sir.
Yes. You have been counseling people also.
Sorry?
You have also been counseling people. Have people not been coming to you to counsel them?
I have, sir.
So your skills have been boosted with this.
Okay.
Yes.
All right, sir.
Yes.
Okay, sir. Emanating from that question, I think what Emmanuel Tete asked, I was thinking a counselor is somebody who is professional or who is oriented in a particular field, which the counselee wishes to be counseled. But from that is a question and your explanation, I learned somebody ordinary can counsel a counselee. What's your take on that, sir?
If you go to the community health profession, there is a book. They have a book called Where There Is No Doctor. Where there is no doctor. So, where there are no professional counselors and you have counseling skills, won't you provide counseling services?
Okay, you go on.
I don't know if I have responded to you.
Yes, sir. Yes, sir. Yes, sir. Where there's no doctor, you made my point clear, sir.
One more question, sir.
Go ahead.
Hello, sir. One more question, sir.
I'm with you. Go ahead.
Sir, please, sir. I want to really know, then, what is my difference between I and a professional? As a master student, can I know the difference between myself and a professional who is trained and me that I'm passing through the lecture? Can I know the difference between a professional and a student passing through the lecture?
Yes. You are not a professional counselor. A professional counselor is one who has. A professional counselor is one who has actually been trained. He has a certification. He has been certified to counsel. He is registered with the Counseling Association of Nigeria and the Counseling Council. He is certified to provide counseling. He is qualified to have a counseling office. He is licensed to practice. You have taken a course in counseling to build your counseling skills. To understand that there are social standards within the society. Now, people keep going beyond these standards or below these standards. So, as a student of social standards development, you can offer help where there is need, where there is an emergency situation. So, you are not certified as a professional counselor, but it is giving you the impetus to understand or to provide explanation to why people behave the way they do, and also to assist where necessary, wherever you find yourself.
Okay. All right, sir. Thank you so much, sir.
You're welcome.
To add up to him, in his village, they have been bringing cases to him to judge, but that doesn't make him a certified judge.
It's all
you
right.
are the judge in this case.
It's okay. So we'll continue by God's grace. We'll continue tomorrow. Tomorrow we'll be looking at psychotherapy. We'll be looking at psychotherapy tomorrow. So thank you very much for finding time to attend the lecture. And have a wonderful day ahead.
Thank you, sir.
Thank you very much.
Doctor. Thank you very much.
Thank you, doctor.
Thank you, sir.
You're welcome. Thank you.
Yeah.